Now, in a closer view, utilizing the skeleton for illustration purposes, we first must find a landmark that shows where our palpation is going to take place. So we must find the C7-T1 transition area. To find the vertebral prominence C7, we're going to palpate posteriorly coming down from the occiput along the posterior surface of the skin, and the first prominent spinous process that you will palpate, typically in most patients, is the spinous process of C7. Therefore, there is the spinous process of T1. So when we do active forward bending and backward bending in the cervical region, as well as in the thoracic and lumbar region, we are going to monitor the spinous processes. Some physicians will palpate each individual spinous process, in this case palpating C7 and T1, and then monitor the separation of that spinous process in forward bending and approximation in backward bending. Other physicians will take their index and thumb and palpate the spinous process of C7 and then the interspace between C7 and T1, and then monitor the separation in forward bending and the approximation in backward bending. Now we're going to demonstrate how to palpate for side bending and rotation, and whether we do it in the cervical or thoracic or lumbar regions, we are now going to use the landmark or the transverse process. And in this case, we must also, again, try to palpate the transition between C7 and T1. So we're going to try to palpate the transverse process of C7 and T1 with our index finger, and some physicians will use the interspace between C7 and T1 transverse process with their index, and then their thumb on the opposite side. Some physicians will palpate with the index finger C7 and the long finger T1. But in this case, if I'm monitoring C7 and T1 on either side, when the patient side bends to the left, you will feel approximation of the transverse process on the left and separation of the transverse processes on the right. When you have the patient actively rotate or turn their chin to the left, you will feel the C7 transverse process rotate posteriorly into your finger on the left when the patient rotates to the left. When the patient rotates to the right, you will feel the C7 transverse process on the right move posteriorly into your finger on the right. Typically, when you do active regional range of motion of the cervical spine, you ask the patient only to move to their pain-free range. Now we're going to just demonstrate how this is performed on a patient.